So, acid reflux happens when the contents of our stomach, including acid, pushes back up into our esophagus. Now, more than 60 million Americans experience this at least once a month.
You have this lower sphincter at the bottom of your esophagus. It's a muscular valve that opens up to allow food to pass into the stomach. No problem, but it's only supposed to be a one-way valve, ideally. Normally, it closes to prevent food, stomach juices from flowing back into the esophagus. But if the valve opens up too far or doesn't close tight enough, what happens? All that stomach acid moves up into the esophagus. That is what leads to acid reflux, can cause that burning sensation in the chest, or what we've been talking about as quote-unquote heartburn.
In addition to those symptoms, you can have things like that sour taste in your mouth or a feeling of nausea after you've had a meal, or even regurgitation, kind of the food coming back up, burping, bloating, as we saw earlier, as well as sometimes stomach discomfort and upper abdominal pain. In addition to that, if you have GERD, you can experience chest pain, difficulty swallowing, a sore throat, hoarseness, and even sometimes a dry cough. And sometimes people complain that they have this feeling like a lump in their throat that they just can't get rid of.
Some daily do's and don'ts just may help you. Don't wear tight clothes or tight belts. It's gonna press everything up. Don't eat overly large meals. Don't lie down right after a meal. Don't eat too close to bedtime or within 2 to 3 hours before you lie down.
There's some do's that go along with this. So do maintain a healthy weight. Pregnant women, people who are overweight or obese can actually be more susceptible to GERD, so weight does matter. Do break your meals up into small meals over the course of the day. Make sure that if you're experiencing these symptoms, you elevate the entire upper part of your body. And you can do that by elevating the head of your bed, or you can do it by sleeping on a wedge so that this part is up.
I'm gonna talk about foods to avoid. Citrus fruits, things like tomatoes, chocolate, mint, onions, garlic, fatty foods, spicy, really hot foods.
It's also really important to watch what you drink. Alcohol, carbonated beverages, coffees and teas. These are all things that can make your symptoms worse as well. And don't forget, don't smoke, because it can really worsen the symptoms of acid reflux and of GERD.
Okay. The good news is, for a lot of people, subtle measures can really improve their symptoms. If left untreated, you'll have to remember, severe chronic acid reflux, GERD, can lead to narrowing of the esophagus. It can even lead to esophageal cancer, difficulty swallowing, choking.
A breathing muscle called the diaphragm separates the chest from the abdomen. To reach the stomach, the esophagus passes through the diaphragm at a point called the hiatal ring. If you have a hiatal hernia, a portion of your stomach is protruding into your chest cavity through the opening in your diaphragm.
The hernia may cause the esophagus and the valve to move up. In that case, the diaphragm is no longer reinforcing the valve. That makes it more likely that acid will get into the esophagus.
Is your heartburn taking your breath away? Doctors find that people with asthma are twice as likely to also suffer from gastroesophageal reflux disease, or GERD.
We had never realized this before, but gastroesophageal reflux disease, which is basically heartburn, acid from the stomach coming up the food pipe, spilling into the throat, sometimes even spilling into the lungs, can cause a tremendous amount of aggravation to asthma-like symptoms.
Reflux and lung disease, what we think about is that contents coming up, being aspirated down into the lung and causing infections. And certainly it can, it's one of the common causes of pneumonia. And actually over time can lead to bronchiectasis, which is more of a permanent damage that occurs in the lungs due to recurrent infections, and then that in and of itself sets the lung up for recurrent infections. problem that brings a lot of patients to lung doctors is cough. People have just a chronic cough. They can't explain it. It's irritating. People start to look at you like you're funny because you're coughing and coughing and you just can't stop. You go and you get worked up, they take chest x-rays, do everything. You really can't come up with an etiology for the cough. So patients who presented with a cough, the large series have shown that over 70% of those patients, the etiology of a chronic non-productive cough, this is a cough lasting greater than about 6 to 8 weeks, was due to reflux. And the treatment of that actually helps calm the cough down and in most cases make it go away.
The development of Prilosec, omeprazole, Nexium, Protonix, Acifex has been such an amazing development because it shuts down the acid. Now, many people are taking them because they have acid reflux. And the gastroenterology specialists have put those people on those drugs with a plan that they'll take them forever, their whole life. And they do that because they felt they were pretty safe. In fact, we thought they were perfectly safe. Now, having millions of people taking millions of doses for decades, we're finding out they really aren't perfect. If you lower the acid in the stomach, it's not normal. Your body is supposed to have acid in the stomach, and that acid in the stomach helps with two things. One is it keeps out a certain class of bad bacteria. There's one particular bacteria that causes an infection called Clostridia difficile. Clostridia difficile causes a bad infectious diarrhea, and so very rarely people on long-term Prilosec have a slightly increased risk of this bad bug. If you have a lifetime of the acid in your stomach being low, the acid in your stomach is really helpful for absorbing calcium that makes your bones. So a lifetime of low acid in your stomach may have an increased risk of a long term of getting some osteoporosis. So there is some risk there. So is it okay to take Prilosec or Protonix or omeprazole or Nexium forever? Well, there's always a risk, but there are millions of people that their gastroenterologists think that's okay. We probably say to our patients now, if you don't need it, we wouldn't take it. If you ended up having to take it, it wouldn't be the end of the world.
Acid reflux, heartburn, GERD. It's a condition many people try to fix with antacids, but eventually the quick fix doesn't work. But there is a solution. Our next guest says the truth is surgery is the only way to get rid of reflux. Please welcome Dr. Clifton Thomas. Hello there. Surgery, you're saying, is the only way to fix it for good?
So the only thing that fixes that broken one-way valve is to do surgery where we reshape that valve. Yeah, so the medications, the main thing that does cause a lot of damage to the esophagus is acid, so it does reduce acid, but it doesn't do anything to all the other juices that are coming back up.
Getting to the root of the problem.
Right.
All right, there are a lot of misconceptions
Exactly.
about whether that surgery can really do that. So what have you heard from patients coming in saying, I didn't think this could really work?
Well, you know, the common things I hear is, number one is, why didn't somebody tell me about this before?
Yeah.
'Cause and that they worry about whether it's going to last and whether they're going to have a lot of bloating or other symptoms afterwards. And,
Well,
and
I say we ask David Willis, who
Yeah.
is one of your patients. Hello there. Welcome to the show. So you underwent the surgery, but not before doing all the things that people commonly do. Because when you have, you know, if you have never had heartburn before constantly, you could go, okay, it's heartburn. It really shuts you down, doesn't it?
It does. You've eating Rolaids, Tums constantly, you know, when you sleep at night, you have to raise your head and, you know, try all that stuff, raise the bed.
Try to eat certain foods. And
Right, can't eat certain foods, and this fixed it.
So life for you was miserable.
It was.
So, all right, what goes into how you actually do this surgery?
So surgery is kind of a two-part operation. A lot of people have hiatal hernias, which makes that one-way valve go out of shape. And also, sometimes just the shape of that valve is out of shape. So on one level, we fix the hiatal hernia. In the other levels, we reshape that valve. And the operation, again, I've done it for 22 years. It's very durable. It's outpatient. People go home the same day. They're usually doing everything within a week.
The longer that you wait, is it true that the more damage you could be causing?
Well, there's more damage, and what really has changed is the rising incidence of cancer of the esophagus. And I don't want to go out there and scare everybody into this, but nevertheless, it's the fastest rising cancer, and we think it's because of the juices that are refluxing up that are not acid.